Seamless care describes a global trend to reform, integrate, and coordinate interagency health care with the common goal of improving the quality of care offered to patients, families, and communities. When we have a patient with a number of different needs or a population with a wide variety of needs, we are able to work across our agencies, within our agencies, and across professions, allowing us the capability to work seamlessly as a team. Team membership often changes. With interprofessional thinking and collaborative practice, really what we want is everyone to be trained in how to work with other people with a broad sense of what a team looks like. We develop everyone's team skills. In the next unit, we'll introduce you to Pat, and it is her story that will help us reflect on these skills and competencies. Working with Pat and her team, you'll need to use concepts of integrated behavioral health. So, for example, my way of understanding Pat comes from being a social worker. As a nurse, you will see Pat in a different way, and Pat's physician might have another perspective altogether. Sharing perspectives and working together makes it more likely that we will offer Pat the best possible care. Tenets of seamless care are patient-centered and relationship-based. Care, cost, culture, community, and colleagues revolve around what patients and their families need. A medical neighborhood brings seamless care into integrated practices, building connections across agencies and communities. Hallmarks of medical neighborhoods include communication, collaboration, and coordination across systems and settings that are inclusive of all workers and providers. Healthcare reform demands that we consider new approaches to best practice. The quadruple aim identifies 4 outcomes that we should all strive for: better care, more satisfied patients, improved patient experiences, and lowered cost. These aims support one another. When people receive better, more coordinated care, their outcomes improve. Better health reduces costs, as people will have less need for emergency services or multiple returns to their outpatient care providers. Medical errors cause unnecessary human suffering and are costly. Poor communication is a root cause of medical errors. When providers communicate effectively with patients and with each other, better outcomes are achieved for everyone. Being listened to and heard are essential tenets of seamless care. Change is challenging. The healthcare system is in a constant state of flux, asking much of providers and systems. We all want to do what's best for patients and their families, but don't always know how to make that happen. How do we prepare for integrated seamless care? So what does Pat's story teach us? Teamwork, seamless care, and medical neighborhoods can improve integrated health practice and outcomes. We can make a difference in how we care for our patients and in how people care for themselves and their communities.